I'm Kayla Sachs. This is my EMS informative speech. I have my parents here, and then I also have my boyfriend as the cameraman, so that's a total of 3 people. Alright, here we go. Every day, thousands of people call 911, whether it's needing law enforcement for a break-in and entering, the fire department for a structure fire, or somebody like me, an emergency service personnel for a heart attack. These are some of the reasons why first responders will get called to a scene. This informative speech will use a heart attack as an example, since 735,000 people have one each year, according to cdc.gov/heart disease. This speech will also include what happens before a call, when a call comes out, during a call, and after a call. First, before the ambulance can even get dispatched, there are several things that have to be done. The first thing is training. EMS personnel will start with a 4 to 6 month course covering the basic life skills. These skills include CPR, basic airway, tourniquets, backboarding, splinting, and many more. After the class, the students go through a practical test, which is the hands-on portion. The hands-on portion has to be passed for the written test to be taken. After the certification is obtained, the EMT will then go on a ride-along to train to be released as the AIC, or the attendant in charge. Some students, like I am, further their education by going to be a paramedic. Paramedic is an intense 2-year college course. A total of 300 hours of clinical times will be due within the 2 years. These include in the back of an ambulance, at the hospital, ICU, CCU, labor and delivery. These skills will include starting IVs, intubating, which is opening the airway for the patient to be able to breathe, reading a 12 lead, which is determine the patient's heart rhythm, and administration of medicines. These are skills that paramedics do on a daily basis. Once this is completed, the student will then go through a practical and written test to obtain the certification as a paramedic. The second part that has to be done before the ambulance can even get dispatched is making sure that the ambulance is ready for any call at any given time. A checkoff list has to be done prior to each shift to make sure all supplies are on the ambulance. If anything is missing, patient care could be rendered and harm may be done. The ambulance also has to have diesel prior to each shift. EMS personnel do not want to be worried about their fuel tank going from call to call. These are only a few things that have to be done prior to the call even coming out. Then it happens. A call comes out. The personnel then get into the ambulance and get information from dispatch regarding the call. After the information, the personnel will then decide how to get to the scene, whether it's using lights and sirens or without. The decision will be made using local protocol, the priority, and the call. The main goal is getting to the scene in a safe but timely manner. When running lights and sirens, it's so important for other drivers and vehicles to understand to move over and get out of the way. Seconds can count in situations, and EMS personnel want to do everything they can to help their patients. Upon arrival at the scene, the EMS personnel will then get their equipment for that call, which will vary on each call. On chest pain calls, EMS personnel will get their monitor, which is the thing that takes the picture of the patient's heart. The first thing EMS personnel do when coming into a household is assessing the patient's ABCs. The patient's ABCs include airway, making sure the patient has an open airway, breathing, making sure the patient's breathing and is able to breathe, and circulation, making sure there's no bleeding, major bleeds, and the patient has a pulse. These are things that have to be fixed first and promptly. The second part is getting information from the patient and or family member. While this is being done, the other personnel will be placing the patient on a 12 lead, which is the monitor to take a picture of the patient's heart. After that is done, the 12 lead will then be read on scene by the paramedic, and the decision could be made what could the possible problem be. For this situation, which occurs every single day, we'll state that the patient is having a STEMI, ST elevation myocardial infarction, aka a heart attack. Personnel have learned in depth what to do in this situation. An IV will be started and medicine like aspirin, nitroglycerin, morphine may be administered. The next decision that will have to be made is if EMS personnel are flying the patient to a different facility or if they're taking them to a local hospital like Martinsville. A catheterization lab is a surgical lab used to look at the patient's arteries and heart chambers. Martinsville Hospital does have a cath lab, which is what the patient needs, but only at certain times. This is why it's so important to stay in touch with your hospital and know their resources. Time is very important in this situation. According to the American Heart Association, the patient has 90 minutes to get from the ER door to the cath lab for the stent to be fully effective. A stent is a balloon that is placed in the patient's heart to open up the blood flow once again. The next process will be getting the patient from the household to the ambulance with the most minimal stress and movement as possible. EMS personnel do not want somebody who's having a heart attack to be straining and moving too much. The patient will then be transported to the most appropriate facility in the most effective way. Many people think that once you drop off the patient at the hospital or place them on a helicopter, that the job is over, but that's not very true. EMS personnel will then have to restock the truck and make sure it's clean prior to the next call even coming out. Another thing that people do not understand is how it affects one mentally. Not knowing if your patient has lived or died can be very stressful on an EMT's mind. In summary, EMS is a job that one has to love or they would not be able to do it. What one sees on a daily basis can take a toll on somebody. This speech has shown what it's like before a call, when a call comes out, during a call, and after a call. There's so many different calls and they vary situation to situation depending on the patient. EMS is a revolving world that nobody knows what the next call will be. Thank you.